traction of the head over the neck requires a specific direction of movement. So when we're tractioning the neck, we are trying to create a space between C0 and C1, C1 and C2 all the way down, and we want to make sure that the forehead stays higher than the chin. So in this case, we want to see a forehead moving up and the chin moving down. You can also look at the mastoid process and make sure that it's moving away from C1 and towards the table. You can really see that motion. C0 and C1 is the first joint that connects the head to the spinal columns, and you can easily see that we have flexion and extension happening right at that level. So that's the specialty of that joint. It's to move in flexion and extension. There is a slight lateral flexion happening, which is debated among professionals to see if it's a true movement or not, but it's a possible movement. Then we have C1 and C2, where they specialize in rotation, and the rest is cervical spine, which does all the movements of the neck: flexion, extension, lateral flexion, and rotation.